Treatment of aspiration pneumonia, as I mentioned, is different than treatment of a regular community-acquired pneumonia. And so a focused history trying to understand why a patient has acquired pneumonia is essential. So asking patients if they use alcohol heavily, if they've been nauseated and vomiting, if their pneumonia was very, very acute in onset, or if there was a couple of days that passed by, is very important when initially interviewing a patient. For community-acquired aspiration pneumonia, the most commonly prescribed antibiotic is Augmentin. While for hospital-acquired pneumonia, that is aspiration in origin, for example, in an unconscious patient, consider using things like metronidazole IV or IV clindamycin. And you may switch to Augmentin orally once patients have clinical improvement, which specifically is defined as no longer having hypoxia, and that should be assessed both in a sitting patient and once they ambulate. The last thing I will say to remember about the treatment of aspiration pneumonia, especially when it occurs in the hospital, is that you perhaps want to wait to initiate antibiotics for at least 24 hours to make sure that the patient doesn't just have a chemical pneumonitis, which will look exactly like a pneumonia, but will recover in the first 24 to 48 hours, period. Because chemical pneumonitis does not require antibiotic treatment.